Good morning, everyone.
Good morning.
My name is Dr. Michelle Nelson, and I serve as the past state president of the United Advanced Practice Registered Nurses of Georgia, also known as UAPRN. I'm here speaking on behalf of the multitude of APRNs across the state, as well as those that are present in the room and outside, and our state president, our current state president, Dr. Nancy Hurlock. Nancy, raise your hand up so we can see you. Okay, there you go. So I thank you for the opportunity for allowing me to speak today. Chairman, the board members, colleagues, and fellow Georgians, thank you for allowing me to say a few words. I come before you as a nurse practitioner, an educator, a healthcare leader, an advocate, but most importantly, as someone deeply concerned about the patients and communities that we all serve. First, I want to acknowledge the important work of the Georgia Composite Medical Board. We share a common mission, which is protecting the health, safety, and well-being of the people of Georgia. What brings us here today is not a disagreement about patient safety. It is a crisis of patient access. Across Georgia, nurse practitioners have spent the past several days scrambling to understand how to comply with the board's recent position statement while simultaneously trying to ensure continuity of care for their patients and clients. Many practices have reported significant disruption. Some have reduced services, others have closed their doors entirely. Countless appointments have been canceled or delayed. The people most affected are not the providers in this room. They're the patients. They are older adults managing multiple chronic conditions. They are working families who cannot afford to take another day off work. They are rural Georgians who may already travel hours to obtain health care. They are individuals with diabetes, hypertension, heart disease, mental health conditions, and other ongoing healthcare needs who suddenly find themselves uncertain about where they will receive care tomorrow. There's another issue that must be addressed candidly and respectfully. The manner in which this position statement was released has profound consequences across our healthcare system. The statement was issued immediately before a holiday weekend. As questions emerged, providers sought clarification through calls, emails, and every available avenue of communication. Yet many were unable to obtain the guidance they desperately needed. I want to take a point of personal privilege here to tell you that I was out of the country in the Dominican Republic celebrating my 25th anniversary when this happened. And I had to field countless phone calls, night and day, without knowing anything myself, trying to allay fears and trying to calm people down. And I still didn't have the answers. Into this void stepped uncertainty. Into this uncertainty stepped fear. And into that fear stepped decisions that have affected patients, providers, and communities across our state. Regardless of intent, the result has been widespread disruption. Healthcare policy does not exist on paper alone. It reaches into examination rooms, pharmacies, hospitals, rural clinics, and family homes. Every regulatory action carries real-world consequences, and those consequences are being felt widespread today. Respectfully, Georgia's healthcare professionals deserve clearer communication, greater transparency, and a meaningful opportunity to seek guidance before being forced to make decisions affecting thousands of patients and clients and thousands and tens of thousands and millions of Georgians. Today is not about assigning blame. It is about acknowledging impact. And the impact has been significant. Nurse practitioners are not asking for special treatment. We're asking for solutions. We're asking for clarity. We're asking for a reasonable transition process that protects patients while allowing providers to comply with regulatory expectations. Georgia's nurse practitioners are highly educated, nationally certified, licensed professionals who provide safe, evidence-based care every day in hospitals, clinics, community health centers, nursing homes, specialty practices, schools, and rural communities. We are proud of our collaborative relationships with physicians and grateful for the many physician colleagues who stand with us today because they understand what is at stake. This is not a physician issue. This is not a nurse practitioner issue. This is a Georgia issue. When healthcare access is reduced, everyone loses. The events of the past week have also highlighted the need for meaningful nurse practitioner representation in conversations where nurse practitioner practice is being discussed. Decisions affecting thousands of APRNs and countless Georgia patients should include the voices of those delivering care on the front lines every day. As we move forward, I respectfully ask for immediate relief, clear guidance, open communication, and meaningful stakeholder engagement to ensure that no Georgian loses access to care because of uncertainty and unintended consequences. The people of Georgia need us to work together, not next month, not next year, now. Let us replace uncertainty with clarity, fear with solutions, and division with collaboration. Because at the end of the day, every policy discussion is a patient waiting for care. And the people of Georgia deserve nothing less. Thank you. Any questions? Any comments before we move on to our next speaker? Thank you for your time.
Thank you. Again, just state your full name and be represented, please.
Sorry, I'm old and need new glasses. Hang on.
And pull the microphone just a little bit closer and speak directly into it. These microphones are not perfect, and you can see if you're not getting it up close and personal, sometimes it doesn't work.
I'm pretty loud. I'm a New Yorker, but I will promise to enunciate. So, all right. Good morning. My name is Dr. Pamela Agravish, and I'm here before you today representing Georgia's nurse practitioner community. I've been a cardiothoracic nurse practitioner for 25 years, and I'm the Vice President of Clinical Operations for LocumTenants.com, which is a subsidiary of Jackson Healthcare, and we are based in Alpharetta, Georgia. LT is the nation's largest placer of 1099 nurse practitioners, and I'm here because the May 7th position statement on IV hydration therapy has created a crisis. One that is harming patients, shuttering practices, and destabilizing a healthcare workforce that Georgia communities depend upon. I want to be clear, we support appropriate oversight, and we support genuine collaborative relationships between APRNs and physicians. What we cannot support is regulatory language so vague and broadly drawn that it is being interpreted as prohibiting arrangements that are lawful, clinically sound, and in many parts of this state, the only means by which patients receive care at all. This position statement was issued without a single conversation with the professionals that it governs. There was no stakeholder engagement, no advance notice, and no opportunity for nurse practitioners to weigh in before their practices were upended overnight. When the NP community raised urgent concerns, this board did not respond, and the pleas were ignored. Since this statement was published, we have witnessed physicians terminating protocol agreements with nurse practitioners, not because those relationships lack clinical integrity, but because the physicians are fearful. The statement's sweeping characterization of compensation arrangements has created panic. Physicians who have collaborated genuinely and in good faith with NPs for years are now walking away, unwilling to risk licenses on language that offers no clear safe harbor for how they have safely and effectively practiced for years. This board governs practice in one of the most restrictive APRN states in the country. Georgia law requires nurse practitioners to have a delegating physician, full stop. An NP cannot practice independently, no matter how experienced they may be. For now, that is the law, and we comply with it. But here is the reality the statement fails to acknowledge. In many parts of Georgia, there is no physician available to serve as a collaborating partner. Rural counties, underserved communities, and specialty-sparse regions do not have physicians standing by willing to enter into protocol agreements at no cost. The NP must find a physician, that is the law. And finding a physician requires resources, matching, and compensation. To broadly prohibit any arrangement in which a physician receives compensation connected to a supervisory role without distinguishing between fee-for-service compliance mills, which we recognize exist, and genuine collaborative practice is to effectively prohibit NP practice in large portions of our state. LocumTenants.com and Jackson Healthcare place qualified NPs in communities across Georgia, including rural and remote areas, to increase and provide much-needed care. We facilitate relationships between licensed, credentialed NPs and qualified, willing physicians. These are not shell arrangements. These are carefully vetted, clinically appropriate collaborations that allow care to be delivered where it otherwise would not be. The statement's broad characterization of third-party matching services as presumptively prohibited without any distinction based on the substance of the clinical relationship is both factually overbroad and practically devastating. It eliminates an entire infrastructure that Georgia's healthcare system depends upon. Finally, I would be remiss if I did not raise a concern that extends beyond this statement. The Georgia Composite Medical Board governs the practice of advanced practice providers, yet no nurse practitioner sits on this board. Decisions of this magnitude, decisions that determine whether an NP can practice, whether a clinic can open, whether a patient can be seen, are made without the perspective of the professionals most affected by them. We are not asking for control. We are asking for a seat at the table. The absence of APP representation on this board is not a minor procedural gap. It is a structural deficiency that leads to exactly the kind of unintended consequences we are discussing today. So we're asking for 4 specific remedies from this board. Immediate clarification of the position statement's language to distinguish genuine, clinically active collaborative arrangements from bad faith compliance. 2, explicit acknowledgement that third-party matching services, when facilitating clinically appropriate NP-physician relationships, serve a legitimate and necessary function in Georgia's healthcare delivery system. 3, a formal requirement that all future policy changes materially affecting APRN practice be subject to a minimum 60-day public comment period with genuine stakeholder engagement prior to issuance and the placement of qualified and vetted APRN on this board. 4, a 1-year implementation runway for any large-scale changes that impact NP practice or collaborative arrangements, giving nurse practitioners and physicians the time to identify compliant paths forward without disrupting patient care. Georgia's patients cannot wait. The practices that serve them cannot sustain indefinite uncertainty. We ask this board to act with the urgency the situation demands and to commit, going forward, to making policy with us and not without us. Thank you.
Thank you. Rob, you up?
Can you hear me? We good?
Yep.
Good morning, everyone. My name is Robin Pinchton. I'm a family nurse practitioner. I'm Director of Government Relations for UAPRN. I'm also a practice owner. I serve 1,000 geriatric homebound patients touching rural areas. This position statement has affected my practice, has affected the 10 people I support as employees with my practice, and most importantly, the 1,000 patients that we see and treat that are frail, elderly, chronic, morbid conditions, Alzheimer's, dementia, behaviors, all that require advanced practice nurses to see them on a consistent basis to make sure they're well taken care of, to decrease exacerbations of illnesses, and most importantly, to keep them out of the hospital. So I just want to backtrack a little bit, and I thank Jason. Julianne and I first met Jason several years ago when he first started, and we formed a very good relationship. But one thing, one thread that keeps coming through here is that Jason inherited the collaborative practice agreement disaster, right? It was taking 12 to 18 months via the paper process to get our collaborative practices authorized, practice agreements authorized. We had nurse practitioners who lost employment, were left in limbo, employers left in limbo because they could not put these NPs to work until these agreements were authorized. We had no communication with the board prior to Jason coming into play. We had no representation, has been said with the speakers before, and we've been working towards that. Now, last year, July 7th, when the thought span process came through, I received a call at 4:45 on a Tuesday from Jason saying, please stop the NPs from coming down to the board, stop emailing, we're gonna fix the thought span process. We had no idea this process was going to be implemented. It was sent out without notice, without training to us, and created a crisis. So here we are again. We received the position statement, Juliana and UAPRN and I, an hour and a half before it went public. As Dr. Ortman said, on a holiday weekend, prior to a holiday weekend. We had no time to plan. We had no time to process, to come up with possible corporate restructuring that we would have to do to make our practices compliant. And now physicians are fearful and scared. Now the board has asked for stories. And I know the Board of Nursing has, I believe as of yesterday, submitted approximately 150 stories of nurse practitioners that are affected. So I know you have those stories. But what we're seeing now last week, I have a phone call from a nurse practitioner in tears. She is finally able to pursue her dream of opening her own psychiatric practice. She secured her lease, her space, her computer system, her staff with SBA loans. The last thing she had to do was to file her protocol agreement. She was unaware that number 12, question number 12 about physician compensation was added to the protocol agreement. We all were unaware. The Board of Nursing was unaware. We started hearing tricklings of this about people getting denied and not understanding why. She is probably going to go bankrupt because she was denied. She's seeking legal counsel. She doesn't know what to do. She has no form of income now to pay off what she thought was going to be her dream. Then we received a call from a women's health nurse practitioner in Brunswick, Georgia. Her physician got very scared. She thought she was doing something illegal because she was being compensated for her consultative collaborative services. That nurse practitioner had a room full of patients waiting for her on a Monday morning, including folks with STDs and other women's health issues. She had to turn them all away and cancel their appointments. We had a nurse practitioner in South Georgia, psychiatric practice. Same story. Her physician was scared, so she terminated the protocol agreement. This nurse practitioner is very, very concerned liability-wise because she has patients who are suicidal. She has patients who are on lots of antipsychotics, all needing refills. Again, her waiting room was full. She had to turn them all away. Where do these psychiatric clients go for help when they're going to run out of their medicines that have keeping them stable, functioning citizens? Do they go to the emergency room? 6 months to get into psychiatry, 6 months to get into neurology. where do they go? I would like to also cover a story, a patient story that we received. This is from a perinatal psychiatric nurse practitioner practice. We all know Georgia does not have favorable outcomes with maternal mortality. During one of the most difficult periods of my life, I struggled to find appropriate psychiatric care while pregnant. I initially sought help from a provider who had limited experience managing psychiatric meds during pregnancy. Rather than referring me to a specialist with expertise in perinatal mental health, I was advised to discontinue medications that were essential to my stability because it was believed that was the safest course of action. Unfortunately, this decision left me without adequate support and contributed to a severe mental health crisis. When I reached out to my nurse practitioner, she immediately recognized the urgency of my situation, was able to prioritize me as a patient, ensured I received appropriate care and medication management when I desperately needed that support. Her expertise in perinatal mental health combined with her compassion and responsiveness made a profound difference during a critical period in my life. And it goes on, I can't emphasize enough how horrific this would be if this practice was closed down and losing my NP. It is easy to speak for everyone else, but I am advocating as much as possible for myself. More practices should have the values and approach that come from my NP. So that's quite profound. So what we're asking for, we would like to see the position statement rescinded. We'd like to have a committee, a special committee, to sit down with the Board of Medicine, with APRNs represented, to discuss the high dehydration clinics. Yes, we agree there are bad actors out there on both sides, and we need to address that and enforce regulations. But the common thread here is that we have not been invited to the table, and everything is reactive. It's not proactive. So we ask that we be invited to the table. We ask that the position statement is rescinded so we can properly, whatever the decision is made, we properly have time to make sure that the thousands of patients that we serve will be adequately cared for. We're also very concerned that this position statement potentially could cause malpractice providers and insurers to pull our contracts because we are not practicing to the letter of the regulation if we're using a third party. So that is our ask. We appreciate the board for listening to us, and we hope to continue these conversations ongoing. Thank you.
Thank you, Rob. Mag.
Let's see if I can manage this. Hopefully you can all hear me. As I stated at the beginning of the meeting, my name is Brent Walker, and I'm the Director of Government Relations and General Counsel for the Medical Association of Georgia, who represents fully 10,000 physician members across the state. And we appreciate the board giving us the opportunity to confer on this very important issue. And before I get to the meat of it, I'd like to thank the APRNs who have joined us in this conversation today. I certainly applaud your passion and your engagement. I think it's an important part of how we move forward to create a better environment where every practitioner can serve their patients. As Chairwoman Cheek noted, the goal here is transparency and collaboration, and the focus is ultimately the patients and the delivery of care across this state. I believe by now you acknowledge that we have sent in a letter of support on behalf of the Medical Association and our physicians. I won't belabor a lot of the points made there, but I think there are important considerations for this board as you move forward and how you address the issues that have been raised here today. Certainly, quite a few of them raised by the testimony that you've heard, or at least the comments. demonstrate important issues that really do need to be addressed. And it's not always within your power, because we have, within the state and within the regulation of healthcare, a lot of enforcement gaps. There are a lot of structural issues about how regulatory agencies and licensing boards work together. You know, this guidance in your jurisdiction as a board apply to physicians and physicians' assistants. The impact to our colleagues at the APRN, you don't have jurisdiction. It's incidental over them. They are under the Board of Nursing. And I think it's an important and very salient point that learning how to collaborate together as we move forward is essential. And I applaud Jason and the board for the work that they've been doing so far to engage with the Board of Nursing and to really take the information that's being submitted and put it under careful consideration. Because we do have to carefully consider what's going on here. A couple of the other points, I think some of the criticisms leveled at the board are somewhat unwarranted. In the initial shock, the issuance of guidance, certainly, but I think that the response of this board has been incredibly transparent and candid. Leading here today, this meeting, it's hard to call a meeting of any executive agency on short notice, but I think this is proof positive as we sit in this room today that we are working towards clarification, that we're working to build a better regulatory environment and include the voices of the stakeholders who are most concerned, and to do it within very specific frameworks that aren't really partisan. They don't have anything to do with healthcare. It's all about the law in the state of Georgia. And the guidance that was issued is just that. It's guidance. This was not a rule change that was proposed by the board. This is not a legislative change. This is simply guidance on how the board will take a look at these relationships between physicians and APRNs and physicians' assistants as well, when it comes to specifically IV hydration therapy clinics. And this is an important thing to consider because I've been a lawyer for almost 20 years, and I know firsthand, working with MAG and in private practice, how frustrating and complex health policy and regulations are within the state of Georgia. But I don't think anyone who is paying attention should be blindsided by this guidance. The statutes that it is based upon and accurately reflect have been in existence and on the books in the state of Georgia for at least 15 to 20 years, if not longer, right? The regulations have been on the books for almost as long as the law has been passed. And there were comment processes when those rules and regulations were done. I don't think that, when we talk about one-year runways and formal policy changes and 60-day public comments, you're bound by the law. And the administrative laws for every executive agency and board in the state of Georgia have a process, but this isn't a rule change. This is a comment. And the board has been incredibly open. As we sat here and listened, there's always an opportunity for the submission of questions. I heard that APRNs were able to submit questions and get answers and have engagement from the board. These are public meetings. It's not a mystery that you meet once a month. Although 7:30 in the morning, we could probably work on that. But it's a matter of engagement, not just by the board, not just by the physician communities, but those who are stakeholders that are impacted by this. And I applaud them for being engaged now. But we have to understand that this is an accurate reflection, and it reflects the challenges of regulation in healthcare, because they are challenging. And I mentioned the law. This accurately reflects the law. Whether we like it or not, we are bound by the law. We have to work within the law to meet the letter of the law. And that's what this guidance statement does. Not just statutory law in the state of Georgia, not just regulations, but also the case law in the state of Georgia. When we talk about the nature of physician-employment relations, the courts in the state of Georgia have extensively examined this issue. And every time it arises within our courts, substance always takes precedent over the form of the agreement. And the courts have developed at least 11 factors to evaluate when we're talking about the nature of physician employment, right? And it all comes down to who controls the physician's time, who controls the manner and the methods that they employ, and who controls the independent clinical decision-making that is at stake in every single one of these relationships every single day across this state. When the courts look at that, they have to look at it on a case-by-case basis, just as the guidance suggests. And this board can do no better than the courts, given the restrictions that you face and the structural issues before you set up by regulation, rule, and law. And that's very important to acknowledge. Yes, this is IV hydration clinics, this is med spas, and I think the board has been very candid in saying that's the target. In my conversations with Jason Jones and members of the board, we understand that this isn't targeted at genuine collaborative relationships where delivery of care is being achieved in a compliant and meaningful way, right? This is targeted towards what we perceive as these sham agreements, these rubber stamp agreements that are economically beneficial but detrimental to the patients in the state of Georgia. And as I was preparing, I looked at some of the websites that were discussed, and they're somewhat opaque, but I think it presents a very unique challenge to understand how these relationships work, and I encourage the board to continue to examine this, because it is an essential aspect of what's going on here, right? The question is the role of the physician as the supervisor, as the collaborator being maintained? Because you are not a collaborator, you are not a supervisor if within the treatment relationship, within patient treatment, if a nurse practitioner or a PA or anyone who is under the supervision of a physician, as the law requires in the state of Georgia, if you're looking to add a therapy, a treatment, a way to deal with a particular patient in a clinical setting, which you're all very familiar with, just a lawyer, I don't always know, but, and the physician disagrees with that, they can be fired. The leverage is there in the relationship, and it reflects an imbalance. That if I don't want you to do ketamine therapy at the IV hydration clinic, I don't think you should be pushing Toradol. I don't think it's appropriate to do this particular cosmetic procedure. And the person that is the subject of supervision disagrees, in the current scenario that we're seeing and looking at, they can say, well, I'm not going to pay you. Well, then what good is the clinical oversight and the independent medical judgment of the physician in that relationship? That's not supervision. That's a sham. And that's a danger to patients across the state that we should be cognizant of. Right? And we have to look on a case-by-case basis. And I applaud the board for being candid and engaging in this process. MAG has been around for 177 years. We have been there at the formation of the Composite Medical Board some 100 years ago. We've been there at the formation of the roles of nurse practitioners and physician's assistants and changes to healthcare and all of that. And throughout this long history, one thing I can tell you, that looking at our archives, is regulation and policy are frustratingly slow. But you have to be slow and you have to be very deliberative in this process. Because if you move too quickly, you create more problems than you solve. So we have to look at it, and we have to look at what's actually achievable here today as we move forward in the future. Certainly when we mention how to collaborate with other licensing agencies, I think that's important and that's very valid. The impacts of stakeholders that are not under your jurisdiction should certainly be considered. And clarification of guidance should always be issued. But I caution the board. It's been suggested that this guidance should be rescinded. I think that that would set a very dangerous precedent in the state of Georgia. In this particular issue, we've heard outcry from those that have been affected by this. But we have also seen, and you are all very well aware of the criticisms leveled at this board and the suggestions that there has been a lack of robust regulatory oversight by the Composite Medical Board in the state of Georgia. Just this week, our friends at the AJC issued the first in a series of articles calling into question the regulatory frameworks in the state of Georgia and the outcomes that it is leading to. This wild west that is opening up, where IV hydration clinics with inadequate oversight are opening, all manner of ketamine clinics, psychedelic therapies, anything under the sun seems to be ready to go because of the perception that there's lax enforcement. That this is a freedom to treat state, which it very much is not. You've heard them testify about the concept that we have some of the most restrictive laws in the state when it comes to practice, but I would contend that we have some of the most effective laws when it comes to patient safety in the delivery of care in the state of Georgia. There is always room for improvement, and we need to be mindful of that, but we need to be very careful. Because if you rescind this guidance, it sends a message that when we attempt to enforce the law, and we attempt to enforce the regulations, if we are pushed back by people with economic interests in the outcome, or people that simply don't like the letter of the law, and you can be made to back down. It sends a signal that Georgia really is a free-for-all state. And I strongly discourage this board, as well as MAG and our physicians, from rescinding this guidance, and strongly encourage you to continue to refine this guidance. As we look at it, it's very clear, the law's been very clear, that it's employment. Lawyers are very careful when we talk about the definition of the word employment, but on a case-by-case basis, what needs to be examined is the nature of the relationship every time it is substance over form. And if there are questions, they should be submitted and answered. And I understand that it takes time and that you're not always available on Friday or Monday, but this process works. This is evidence that the process is working. We are all here. The public is here at home. They'll be out there and they'll be here to engage with this. And it is a long journey that we have to walk together, whether we agree or not. But we must always be mindful of why we're all here, and that's for the patients. I thank you for your time. I thank you for your consideration. I'm happy to take any questions.
Thank you, sir.
Thank you very much to all our speakers. You all gave very great presentations, and like I said, we've had a wonderful opportunity through this forum and also through just some of our private conversations to listen, and that's really what we've been trying to do, to listen. We understand the impact this has had on the providers. We are all here for the patients, everybody, the whole room. We want to get it right. You know, we understand the outcry. I do want to say, from a board's perspective, and I am very certain we're not targeting any group, med spas or IV. We are trying to provide good health care for all the citizens of Georgia. There is no target on anybody's back. There are good and bad providers across the board in all sectors. And so just let me say that from the start. There's no target. We're just trying to let people be informed about the laws as they were presented to us and have been presented to us over time. We have heard that presentation of the law has been interpreted differently from other perspectives, and we're taking that into consideration. We have to listen to all sides. We have to do this. We understand that. We very, very much appreciate your time, your efforts, your statements, your support, your people that are at Liberty Square. We appreciate everybody. We understand that this is a very passionate topic. We all want to get it right for the citizens and the patients of Georgia. We're all in the same boat.